Good morning, everybody. My name is Ethan Wright, and today we're going to be discussing cannabis use disorder and using the DSM for diagnostic criteria and features. The etiology of CUD include environmental factors, which speaks to peer influences and cultural attitudes, psychological factors, which are the coping mechanisms that people tend to fall onto when they have CUD. Is it Cannabis is often used as a coping mechanism. So you found yourself with a client that you may believe is suffering or has CUD as a diagnosis. Now you may be wondering how you would formally get that diagnosis. It's simply by following the DSM criteria that you see here listed on the screen. To meet the diagnostic criteria outlined in the DSM-5 TR, the client must have at least two of the following criteria points occurring within the past 12-month period. And a few of the most common ones that you would see within your clients would be persistent desire or unsuccessful efforts to cut down or control cannabis use. A great deal of time is spent in activities necessary to obtain cannabis or use cannabis or remove its effects. So that would mean there's a specific amount of time that is being used to receive the cannabis, smoke cannabis, ingest it, and then recover from the effects, whether that is coming down from a high or mitigating withdrawal symptoms. You would also look for failure to fulfill major role obligations at work, school, or at home due to recurrent cannabis use. You will see a need for markedly increased amounts of cannabis to achieve intoxication or desired effects. The more our clients use cannabis, the higher their tolerance is. So as they are continuing to chase the euphoria or the relaxation or whatever sensation the cannabis is providing them, they have to continuously increase the amount that they're ingesting on a daily or a weekly basis. So that is a major criteria that you would look for as well. And finally, you would look for withdrawal symptoms. If there is somebody that is constantly using cannabis, if access is cut off, you will see the harmful effects of withdrawal. Finally, after you feel comfortable with the diagnostic criteria, it's also important to look at how your client is presenting. Those who meet the criteria for CUD often present with the inability to stop consistent cannabis use. They're going to have signs of dependence, which is the strong need to use the substance to perform tasks, i.e., you'll see individuals that feel like they have to smoke before they eat or ingest cannabis before they eat or to even attend social events or even go out into the public. You'll see withdrawal symptoms, which can look like irritability, sleep difficulty, decreased appetite. My apologies. Anxiety, restlessness, depressed mood, or